So, despite the benefits of telemedicine, there are existing barriers to the adoption of telemedicine. Despite the growing evidence that telemedicine may be effective as a face to face intervention, there is a lag in the adoption of this alternative treatment method by allied healthcare providers and nursing. Some of the barriers are individual, so knowledge, personal preference, and lack of technical skills. Also, in regards to the workplace, there might not be a support for telemedicine, or they don't have the resources available to make that part of their practice. There may be, money needs for like training and recruitment. Also, in regards to the short-term costs of implementing telemedicine into the practice and the long-term benefits of the telemedicine, the medical group might have to weigh. Also, there's concerns with insurance and liability, so legal issues, privacy issues, malpractice issues, and also in regards to informed consent. There's also maybe within the group practice, maybe the clinicians or staff has negative attitudes towards telemedicine and don't agree with the potential benefits. Also, maybe patients, maybe they're more traditional and they're not comfortable with telemedicine or using computers in order to talk to their provider. And others is like service providers. Also, patients may not just be aware of this option, telemedicine, so maybe the information is not available to the patients. So that could be also a barrier. They're not aware of it. Another con, just in general, is that usually when we do our assessments, or when the providers or the nursing, whenever we our physical assessment, we're always in with the patient in the room, right? So we're touching and in contact with them. So there might be limitations with using telemedicine, is where you just use your eyes, but there's no way for you to touch or hear. So that might be a barrier as well.